I'm Rachel Graham, I'm the Assistant Director of Dining Services. Welcome. So we don't have commercial size equipment. We have regular residential size. So we can't fit 3-gallon tubs of ice cream in our freezers in the homes. So when we opened 2 years ago, we were very limited on the vendors that could get us half-gallon size ice cream. We didn't want to go to Publix, so we found Board and Dairy, who was charging us $5.73 per 48-ounce container, a typical half-gallon that you would pay at the grocery store. So with the Instacarts now and the BJ's delivery, home delivery, all of that, we did a trial the last 3 months and found that through Instacart with BJ's, they can deliver us 68-ounce containers, so even bigger, at only $4.98, including the tax delivery and the Instacart fee. So we were saving 4 cents an ounce. Doesn't sound like a lot, but when you're ordering over 4,500 ounces a week of ice cream, it is a $9,318 savings a year. Wow.
Hello, my name is Denise Casiopo. I'm the Executive Director of Imaging Services at Boca Raton Regional Hospital. I'm here today to share with you my departmental experience in a workout called In Quality Staffing, aka IQS. The purpose of IQS is to identify you have the credentialed staff performing the necessary tasks during the hours of operation. Simple? You would think it would be simple, but you would be amazed of what you don't know. When it's your staff, your data collection, your review from the department, all in black and white, it just validates that the information is true. So here's some examples that we experienced and impactful plans that we implemented during our IQS workout. At the hospital, our main MRI, 80% of the time, our first 2 slots, we were waiting with intent. So we immediately converted our inpatient slots to outpatient slots, converting to over $216,000 of collectible revenue. In our mammo schedule, we have built-in blocks. The whole idea of mammography is that we really work with no delays, and it was our catch-up time. The data identified we actually were a little better than we thought. So we removed those blocks and we were able to capture another 2 patients a day, equating to about $36,000 in collectible revenue. From an ultrasound perspective, the data indicated that 6 a.m. I was a little overstaffed. So what we were able to do, and the plan that we implemented, is we changed the time from 6 a.m. to 7 a.m., covered the changes shift, and we were able to cut overtime by close to $42,000. So the one plan that I'm most proud of is the collaboration with the emergency department. We were able to analyze their data and their peak times of productivity and compare it to our transport times and staffing model and come up with a change to change our transporter staffing model to dedicate a transporter to the ED during their peak times. It improved their efficiencies, and according to the plan, it was priceless. It's all about the one more change. It's not the $1 million impact, but it truly is how the staff is engaged. We've given them the resources, and we were in it to win it, to have the best patient experience. Thank you.
My name is CB2, and I'm the Director of Health Information Management here at Boca Raton Regional Hospital. And during our waist workout, which was one of our first workouts, we implemented a nursing bedside procedure charging project. We worked with collaboratively on a huge team with our patient financial services, nursing informatics, information services, health information management, revenue integrity, as well as our nurse auditor. And one of the things that we looked at was just retrospectively looked at things that we completed and performed and weren't charging for. And for 1 year, we were able to collect from the payers a little over $1.1 million. So going forward, what we're doing is we've implemented a coder who is charging for these procedures And this coder is sitting in the Health Information Management Department here today, and we're able to collectively charge for these procedures going forward. The one thing that's really great about this project and this workout and this particular plan was the collaboration that we had with a multidisciplinary team, as I mentioned before.